Welcome back to Building Tomorrow, where conversation sparks solution. Today we are going to dive deep into a national crisis that's taking over our youth: drug abuse. It's not to shame, but to break the silence and to build solution. Joining us today is someone that I am honored to have, a prominent public figure, an advocate of an end to drug abuse, and also working closely with General Muhammad Buba Marwa, who is the chairman of the Drug Law Enforcement Agency, Dr. Adekunle Adesina. It's a privilege to have you here, sir.
It's my pleasure. Good afternoon.
Good afternoon,
and good afternoon, viewers at home.
So, let's begin. Doctor, personally, this is a topic that is so painful for me, that not because I am a victim or I have been into this or have come closely with anybody that has gone through this, but because it's something that's taken the complete life of our youth that have potential, that have a bright future, but go into drugs and everything is tarnished. So, doctor, why has drug abuse become such a deep-rooted crisis in Nigeria, especially among the youth? What are we missing in the fight?
Yeah, thank you very much. Like is commonly said, that multifaceted problems will also require a multifaceted approach. You see, nobody can lay his or her hands on what the causes of substance abuse is, but of course we know that there is multifactorial. Multifactorial in the sense that you have peer pressure, you have socio-economic problems, you have biological factors, you have psychological factors, and even up to social factors. So it's a multifaceted, multifactorial causation that will have predisposed us to getting to where we are currently. But one thing that is of importance is the fact that the westernization of our communal living, of our communal family system, is contributing a lot to where we found ourselves. Before now, a child belongs not to the family but to the community, in which it said it takes one person to give birth to a child, but it takes the community to raise the child. So before now, the community raises their children up together. But now, everybody is locked up in their estates and in their houses. And then if my child is erring or is going astray, you don't have the right to correct my child. I don't have the right to correct your child. And then you see our adolescents with their experimental brain. The nature of the brain during the adolescence age is experimental in nature. We shouldn't forget that the prefrontal cortex is one of the last part of the brain to be fully developed. In fact, it continues to develop up to the age of 25. And that is the time that our children or our youths leave the house with little or no monitoring. They gain admission into the university by 16, by 17. Parents forgetting that their brain is not fully developed. And that frontal cortex is actually the judgment center. That's what makes us to be able to make good judgments. It's what makes us be able to make good decisions. So you see most of the youths, because of already that biological factor, making silly decisions for themselves, experimental decision. And then, some of these psychoactive substances, they are highly addictive to the point that one exposure can make you a victim.
What are the common substances in circulation now? And how are they affecting mental, physical, and social health? Like, what trends are they observing among young people? Because I have heard so many things that because due to how expensive some of these drugs are, they're using other alternatives. Over to you.
Yeah, so there are a lot of psychoactive substances now, funny enough. In fact, there are other ones that are, we call them non-conventional or unconventional psychoactive substances that are not actually documented, but they are now newly discovered, and then you see youths experimenting on those substances. Things like gutter juice that nobody will have in his right senses gone to brew gutter juice and be drinking. But we now know that these are unconventional means of looking for high. Lizard dung before now should just be an innocent dung, but now we now know that unconventionally people high on those substances. So there are lots and lots of them, but of course the commonest in our environment is cannabis, marijuana, the regular marijuana. Of course we know that even the cannabis now has different brands. They have the Canadian loud, the Ghanaian loud, and then the synthetic form that is everywhere now. That's Colorado. There are different forms of psychoactive substance commonly in our environment, to the point that you now get to the ones you raised, like maybe cocaine that used to be very expensive. People now have the alternative forms of it in form of crack, in form of other psychedelics like even methamphetamine that has the potency of even cocaine itself. So with that, we say we have a drug pandemic situation. In fact, because of the advent of crack cocaine, so that is a game changer in our society.
So, doctor, going on to the perception now, what are the biggest misconceptions society holds about drug addicts? Like, how do they hinder recovery and reintegration?
Yeah, I think the biggest, in my opinion, the biggest so far is the fact that people think an addict became an addict because of moral failing, forgetting that addiction is a disease of the brain. It's actually a medical condition, not a moral failing, not because I'm weak or not because I refuse not to stop the substance I was using. But of course, by the time the diagnosis of substance use disorder is made, we know that this person has a medical condition. And that's why if you see the journals, we'll say addiction is a chronic relapsing disorder of the brain that is characterized by compulsive use of a substance despite the obvious grievous consequences. So the person is aware of the obvious grievous consequences, but the person cannot but use the chemical. The person does not want to use, but the person finds himself, him or herself using, and that is a disease now. So it's a chronic disease in the class of high blood pressure, in the class of diabetes, that if you consciously manage it, it wanes. If you're tired of managing it, then it waxes stronger. And that's a misconception that the society needs to work on, not thinking you can't ostracize or you can't isolate or stigmatize somebody for developing diabetes, even though we know that there are lots of predisposing factors that will make us diabetic. But borderline is the fact that there's a genetic predisposition. The same way there's genetic predisposition to diabetes, hypertension, the same way we have genetic predisposition to developing addiction as a disease. So if 10 people experimented with different substances and I'm unfortunate to have been addicted to the chemical, then I should be treated as a patient, as a client that needed help, and not as the black sheep of the family.
Wow. There is this person that lives where I am, actually, and the mother called and was saying that she's going to send him out of the house because he's into drugs, he's selling everything in the house, and this is someone that, seeing you seated this way, he can draw you like perfectly. I mean, that's a gift. And it was so painful that, like, why would you send away your child out of the house because this child is into drug abuse? And I feel this is not the best approach for parents. So, doctor, what role should parents, religious leaders, and schools play in both early prevention and healing? And are they equipped for this role? How can we empower them more?
Yeah, thank you very much. I think even this was a paper I delivered at a conference just yesterday with the Governors Spouses Forum, Governors Spouses Forum, and the NDLEA about community approach to preventing and treating drug abuse. The analogy that was florid at the conference was the fact that if someone has a first stage cancer now, diagnosed of cancer, first stage, we don't want to wait till it gets to stage 4 before we start treatment. If there's first stage and we're able to diagnose it on time, then we deal with it at that stage. We need to demystify what even the diagnosis and the screening of substance abuse should be demystified. Everybody should be able to have access to early screening and diagnosis. People that got to the stage of selling properties and all of that would have done a lot of things if addiction treatment or rehabilitation is incorporated into our primary healthcare system. Because already everybody uses the primary healthcare system or the primary healthcare centers in villages, in rural areas. So if there's high index of suspicion at those levels, this young man is experimenting with a substance, with Colorado for instance, and then is talking out of context, there should be a community health worker should be able to pick it at that level and then should be able to refer appropriately, even if he or she cannot administer simple addiction counseling or psychotherapy. But we know that at that level, addiction counseling and psychotherapy will even be enough to manage that condition at that time. Not us waiting for the person to get to the point of selling things and then parents considering chasing out of the house. Of course, addiction is a family disease, not necessarily because it's genetic, but because as is whatsoever thing the fellow was doing was also affecting the parents, the mother. So addiction creates monsters in your support system. That the mother that is supposed to support that fellow, for instance, now is now chasing out of the family. You won't blame her for doing that. Maybe he has carried a machete to want to attack the mom. Maybe he's carried a knife. Of course, law of preservation says you should preserve yourself first. So you might not necessarily blame her for that, but at the early stage, if diagnosis is made early, it's always better and easier for the clinicians. But even for the man in question, sending out of the house does not treat addiction
at all.
Instead, in fact, if addiction is a spirit, the spirit of addiction will be dancing and be happy that you have chased out of the house to the street, and it will not still and it will not still pity you. It will not pity the young man too, not to destroy him. No, in fact, that's when it feasts on the person, because what addiction wants to achieve is for the person to be naked and to lose all support. So that is the time to ask for help and check the young man into treatment so that we can give him a second chance to life.
Yeah. So doctor, you just mentioned a conference that you recently was a resource person, right? During the technical session, right, where there were different representatives, the NDLEA were present. So there was a highlight of the role of state leaders and the establishment of the state drug control committees, right, as pivotal in this fight. From your perspective, how can this high-level commitment be translated into tangible grassroots actions that effectively address the drug crisis in our communities?
Yeah, thank you very much. In fact, at the end of the conference, we came up with a communique, and one of the things that was written down in the communique is for all the governors' wives or spouses to return back and domesticate this. Because already there was one of the presenters, we had the resources within our community. We have to start from where we are. We have to just start. We can't be trying to bring in highfalutin things to solving our local challenges. Already there are existing LGAs in every state. There are local governments. And those local government areas and government councils have councillors, chairmen, chairpersons in those wards already.
Sure.
And every local government also has primary healthcare centers. So we can domesticate by starting from those areas, by instituting simple training programs to be able to train the health workers already existing in those primary healthcare centers on how to screen for substance abuse. Just simple screening tests, simple urine tests, and how to interpret. And then if we are able to succeed in that, we can go further to training them. Okay, if you see this is what it means. We don't want to wait for, all the professionals to come from Abuja or to come from Lagos to come and help do a drug screening test. Every pastor can do that. Every imam can do that. Every teacher in school should be able to do that.
Absolutely.
Like pregnancy test now. Everybody does pregnancy test at home. You can do, and then parents can buy the kits and check their children. With that, in the grassroots, there will be early diagnosis. And they will not be referring our clients to Babalawo centers or to churches where they will chain them or anything. The health worker there will be able to refer appropriately. And with that, we have gotten to the primary level of care, which is the root of the problem. And then we can start moving forward from that point.
Wow. Such powerful insights from Dr. Kunle. We're gonna go on a short break, and when we come back, we'll dive even deeper. Stay with us. Welcome back to Building Tomorrow, where conversations spark solution. If you're just joining us today, we're with the one and only Dr. K, Dr. Adekunle Adesina. Doctor, welcome back.
Thank you very much.
Now, I want to ask you this about the strategies that has actually worked while doing this, while handling, patients at your hospital, and so I just want to know what prevention or rehabilitation strategies have proven to work best in your experience, especially at community level.
Thank you very much. I think the mantra that says prevention is better than cure, in fact, is the most befitting mantra for substance use problems or substance abuse. At the community level, it's better never to start at all than to plan to get out of it. So the first most important strategy that's worked is a preventive approach, and that's what we are trying to incorporate now, that we are able to prevent from the primordial level of prevention, where we have adequate legislation, adequate advert regulation, age restrictions to gateway substances. Because as simple as alcohol and cigarette, these are legal substances in our environment, but we know that they are gateway substances, that if the brain sees them before the age of maturity, before 18 to 20, the brain is likely to crave for higher substances moving forward. So if we tackle it from that primordial level, we go to the primary level where we are raising a community that is psycho-educated, that everybody knows the implication of doing what. We are winning the battle already. And then by the time we leave the primary level of prevention, we get to the secondary level where the community, there's anybody that wants to now experiment with substance, there's early screening and early detection. We don't need to get to the tertiary level. That even if there will be one or two people that will experiment in this community, there's a system in place to catch them very early. There's early screening, there's early diagnosis, early detection. Of course, that will lead to early intervention.
That's the perfect strategy.
If we now have other ones that move to tertiary level of prevention, where we now talk about rehabilitation, and at that point the goal of rehabilitation will now be to, let's limit the harm, let's do harm reduction, let's improve the quality of life of all of these people. But we can't decorate the whole of our society with beautiful rehabilitation centers without doing the first three most important ones. We can't say, or somebody is just experimenting with substance now, or we cannot make our environment to be substance free, and then we now want to have them all in the rehab centers. How much of the clients can we admit in rehabilitation centers? How much of bed space do we have in the country? So those are the questions that we have to start from. Our laws has to be up to date. There has to be strict legislations and implementation of those laws. So with that, we'll be able to progress from that point.
Yeah, but are there innovative or tech-based models Nigeria can adopt from the world? Like, or even homegrown ones that we are ignoring?
Yes, there are a lot of strategies, but the bane of a recovery process is that there's no one strategy that works for everybody. In fact, what makes treatment to be very difficult is the fact that treatment has to be individualized. You have to customize everybody's care for them. So what works for you in your addiction recovery will not work for me, it will not work for the next person, because the etiological factors are different. The predisposing factors are different. The accentuating factors are different. Do you understand? We might be exposed to the same risk factors, but with different accentuating factors or predisposing factors or even etiological factors. So whatsoever model that we are generating, preventive measure is the number one most important. That we must go beyond looking for how we will treat drug abusers. We should start thinking of how we will not have new recruitment into substance use. So preventive measure is the way to go.
Sure, I completely agree. But doctor, if you had just 1 minute with the president, what specific urgent action would you recommend today to tackle drug abuse?
Okay, 1 minute with Mr. President and how to tackle drug abuse. In fact, most importantly, what I will do is all primary healthcare centers should start screening and initiating treatment. All primary, we should know enough of missed opportunities. Don't forget that people now start their first cigarette by the age of 9 or 10. At that time, they cannot even tolerate it. The person will have come up with upper respiratory tract infection. If a community health worker can have a high index of suspicion, of course, that means we have also trained. We have also trained them.
Yeah.
We have equipped them.
Yeah.
Can tell the mother, Hajia, this is not just upper respiratory tract infection. I think we should do a drug test. Yeah. And then we are able to see cigarette in this boy's urine at the age of 9. We can deal with it immediately.
Yeah. Immediately. Yeah.
We can handle it immediately. With simple counseling and psychotherapy, this person will be good to go. So, a meeting with Mr. President will be how we will truly incorporate drug treatments into our primary healthcare system, drug abuse treatment into our primary healthcare system, and then we can be able to catch them much earlier than we are doing currently.
Doctor, in the creative industry now, somehow they actually show kids that are watching those things how to use these sort of substances. Right, so how can we turn the tide using Nigeria's creative industries, the music, film, social media, to reverse the glamorization of drug culture?
Yeah, that's why I said at the primordial level of prevention, there has to be strict restrictions, strict rules, legislations, the kind of music we allow in our space, the kind of advert we allow in our space for the future, for the young generation. There must be strict legislations.
And the
kind of content that is being aired in our space, it's our own space. We can regulate it, we can restrict it. You're a musician in Nigeria, you cannot have this kind of content. And then the Nigerian Broadcasting Corporation can do that. We've seen them banning some music and all of that. Why not? But we should go beyond doing paying lip service to the point of bringing up strict legislations. At that time, we'll be preventing substance use from the primordial level, where there are existent laws that I know that if I glamorize drug use, this is what happens to me. Because it's not because of you alone, it's not because you can tolerate the substance, it's because of the future generation. Even up to parents. legislation on parents. Some parents smoke in front of their 2-year-old children. We have managed children from emergency room that came down with pneumonia because of smoke coming from their father. Their father smoke in the house, smoke shisha in the house, drink shisha. What is the human rights violation of those children's rights? Those are points of enforcement and strict legislation and enforcement will come in. That even parents, if you do this in front of children, then this will happen. We know that you can't smoke openly in Nigeria, but I don't think anybody is enforcing that because people still hold cigarettes everywhere. But there's already an existing law in Nigeria that you cannot smoke in public places. So what comes to that rule? Who enforces that? You want to smoke cigarettes, go and smoke your brain off in a smoking booth, not in a public place. That is the law in Nigeria, but we are not enforcing yet. So those are the areas that we have to dive into.
If we give this platform to impact 100 youths at risk of drug abuse right now, what would you do first, Dr. K?
Yeah, everybody should just post something and say no to drugs. Every youth watching should post something because there's somebody that is contemplating. There's somebody that is passing through a condition now and is thinking, should I escape with drugs? But if all of us can wake up in a day and say, oh, say no to drugs, drug does not solve your problem, just on our WhatsApp status or story, it will go a long way for us to create a better future for ourselves.
So, doctor, I want to challenge you. Are you ready?
Yeah, I think so. I think I'm ready. If I need help, I will tell you.
So, this is the impact challenge of hope beyond recovery. Yeah. So, as a change maker yourself, committed to ending drug abuse, we want to challenge you to do 2 things at Building Tomorrow. One is the rehabilitation pathways. We would want to identify and want you to help sponsor or connect at least 5 youths that are currently battling addiction with access to reputable rehabilitation programs where they can actually get medical, psychological, and spiritual support. That's one.
Done deal. That's very easy.
Well, I think I'm going to give you the
That's very easy.
Okay, so the second challenge, which is an empowerment, a chance to be empowered. We would want you to mentor or support again at least 5 reformed youths, those who have completed rehab with tools to rebuild their lives, either through business grants, vocational training, or internships, so that we can turn recovery into productivity. That's 2. Since the first one was easy, I'm giving him 3.
Yeah, even the second one is very easy too.
Oh.
Do you know why?
Why?
Because there's a system in place.
Okay.
Like Serenity Royale Center for Social Rebirth.
Yeah, hospital.
Not the hospital now.
Oh.
The NGO aspect of hospital is Serenity Royale Center for Social Rebirth.
Okay. Well,
what we do is to actually look for indigent clients, indigent people, and then we have recovering addicts that are willing to sponsor other people into treatment.
Wow, that is beautiful.
I chair Recovery Advocacy Network in the country where we run an annual conference, Fly Above the High, which I'm the president of the group. It's a network of people in recovery. In fact, the last one, the former president was there.
Yeah,
yes, it was around. And every penny that was spent from the conference was sponsored by recovery addicts. 5 years in recovery, 7 years in recovery, 10 years in recovery from all over the world. So, sponsoring someone into treatment, that is very easy. 5, why not? We can easily do that.
Then let's increase the number.
Mentoring now, it's an ongoing thing. We have recovering addicts with big companies that will send. I can call Dr. Abubakar Salamina and say, hey, I'm sending 2 guys to you for mentorship.
Awesome.
And then he takes them in immediately. Lot of organizations that we partner with at the center. So that will also not be a difficult. So let me see whether the third one will be difficult.
Okay, okay. The third one is going to be about drug education drive. Right, so we would love to have you lead a drug awareness campaign through community outreaches in at least 3 schools or youth hubs. Yeah, so let's educate others before they fall.
Yeah.
Yeah.
I think we can plan to have that. Maybe we come in and collaborate together, and then we'll be able to identify specific schools where we can go, educate them, psychoeducate them about substance abuse, and teach them screening techniques, and maybe drop some drug screening tests for the principal of the school, where they can now easily test students from time to time.
Okay.
So I think it's what we can do. Is a nice innovation. So we need to come out of our offices now.
Yeah, that's all about building tomorrow. Yeah.
We need to step out of the consulting room.
So because outside the studio, we want to make impact.
Yeah.
Right? We could actually choose from our audience, from our subscribers, from the community. It could be anyone. Right? So it's not recovery. It's not the end. It's actually the beginning. So through this challenge now, we're going to turn pain into purpose and addiction into action.
Yeah.
Thank you so much, Doctor, for honoring our invitation. It was truly nice having this conversation with you.
It's my pleasure.
And to our amazing audience for watching, thank you. See you next time on Building Tomorrow.
I didn't know this thing is this difficult. I guess people presented on TV.